My name is Tim Ria, host of Digital Health Live for the Digital Summer Summit here at UCSF. Excited to have Dr. Michael Blum, who's Associate Vice Chancellor of Informatics and Professor of Medicine in Cardiology, Chief Medical Information Officer, UCSF. Good to see you again.
Good to see you, Tim. It's quite a mouthful, huh?
Yeah, that's a good one, though. But I'm super excited that you guys are the co-host of the event this year. I think I saw you at Informed Health, right. and then also at CES.
Right. So this is really exciting for us to be able to bring the Summer Summit here to UCSF to really be able to start talking about the transformational partnerships that are happening. The excitement in digital health continues to grow. Fitbit's IPO hasn't hurt that at all. And this is a really fantastic meeting, lots of attendance, lots of great questions, just super time for us.
So we were talking about the keynote, which we were hosting, which is transformative partnerships. Give some people an idea of where you came from and what's happening with the public-private partnerships now.
So what's the transformation? Aside from that, it's a really cool word and gets people excited. Yeah. So traditionally, the partnerships in healthcare were really around an academic center would invent something, a molecule or some new therapy, and then we would license it out to the industry. And it's very different when you're working with the digital health space where you have the technologists and the engineers coming in where they've got a new technology and they want to understand how it plays out in healthcare. Our first start was, okay, we can kind of behave the same, we can license out technologies, we can do clinical trials with these new technologies, and then we understood finally that there's a fundamental difference in working with the technology sector than there is working with the life sciences sector. The life sciences folks get it, they get how academic healthcare works. The technology folks think it's very similar to when they have interactions and partnerships with banking or with manufacturing. And this is a very different space. This is about how we invent and how we validate things that are going to impact people's lives, impact their wellness, impact their health. And that takes much longer. It requires validation. It requires different kinds of investment. And so we've had to form partnerships that are different. We've had to transform out of an old service provider kind of partnership, here's a manufacturer, they're bringing something in, into something where we're creating ecosystems and we're really creating partnerships that are multi-way partnerships, that are longer lasting partnerships, and that are changing the way things are not only done in healthcare, but they're also changing the way things are invented out in industry. Great example I talked about is the tide pool project. So a very stable industry, a well-known disease, type 1 diabetes, insulin pumps, glucose meters. The technology had advanced tremendously, and we really understood the technology of delivering insulin and the technology of measuring glucose. But what we didn't understand was how to best manage the disease, how to create the partnerships between the patients, the parents of these kids, and the providers. And we needed a fundamental new technology to really bring all that together. And that required really disrupting and transforming the whole industry. We had to move away from the vendors owning the data, the silos of data, and the providers trying to keep up with more and more data coming at them. So the transformation there was the data no longer lives with the device. The data is really the patient's data, and developing technologies that didn't just deliver these new huge streams, these big pipes of data flying at the providers wasn't helping. We really had to develop technologies, and Tidepool developed the Blip technology that creates a new analyzed visualization of the data that the providers can really look at, that they get information, they get knowledge about what's going on with the patients. And not only that, but the patients, the parents, the kids can see this same visualization as well. And they can look at this, so they don't have to be a doctor anymore. They don't have to know what all the numbers mean and how you line all the numbers up. The parents and the kids can now look at these graphs that are, pretty straightforward to understand that my glucose was too high, my blood sugar was too high right there. I saw my insulin go up, but it went up too late, and then it brought it down.
That changes behavior.
Absolutely. That changes how they interact with the system. Now they're much knowledgeable about managing their disease, their process. So they're much more informed. They're much more able to engage with the providers, and the whole system works much better. But that didn't happen until there was this transformation out of the silos of technology into the ability to aggregate the data, analyze the data, and create information that the providers could use. So one good first example of a big transformation in the industry.
You're still looking for partners people can engage with you guys, or how does that work?
Absolutely. That's another big piece of this, is these are not point partnerships between an academic and a technology provider. We have to create ecosystems. There are lots and lots of players in this space, and no one player is going to get all of this. We need ecosystems where different players who have different technology expertise can come in, and we form very open partnerships, so we encourage people to go in. The Samsung partnership, when we last met, is all about creating an ecosystem around sensors, around wearables, where they're going to create the platform, they're going to create the reference standard, but they're encouraging all the sensor manufacturers, the partners to come in, the analytics providers to come in, build on that platform, build on the SAMI platform, because no one's going to do this by themselves. Way too complex, way too big.
How do people connect up with you guys?
So we're easy to find. It's UCSF, so it's the CDHI, which stands for Center for Digital Health Innovation, cdhi.ucsf.edu. Form right on the website. How do you want to work with us? What space are you in? Why do you want to work with us? And we talk to everyone who reaches out to us, and we encourage everyone to do so.
It's a great team down here. I love coming down every time I have a chance to come visit. And you got to check out the new hospital here, too. It's amazing.
It's fantastic. It's really such a contemporary space, great new uses of technology. Really amazing when you walk through how quiet it is because of the design of the new hospital and the new spaces. Lots of robots running around the new spaces. Yeah, it's fantastic. We encourage people to come check it out and see what the future of healthcare delivery looks like.
So that's Dr. Michael Blum here at Digital Health Live at UCSF. Cheers.
Great. Thanks very much. Great to see you. Look forward to next time.